Hello and welcome to week 12 of NUR1000. First, we're going to look over some of the week 11 assignments. We're going to look at the discussion board posting as well as quiz number 2 answers. And the practice math that you did provided answers when you submitted the quiz. So if you had any questions about that, please reach out. Let's take a look at the discussion board. So the discussion board explored intrinsic and extrinsic motivation. You guys all did good defining those and discussing sort of what was your motivation. I like this tip from a student. Intrinsic is inside or inner reward, and extrinsic is external or outer reward. You then went on to meds and you watched a couple videos, one about ibuprofen, the other one about acetaminophen. And you were trying to pick out your top 5 nursing considerations. So when I say top 5 nursing considerations, I always consider the classification as one thing of the 5 that you have to know. Sometimes you have meds that might have a couple more than 5. Other times it's a stretch even to get the 5, like heavy need to know things for a medication. But ibuprofen, acetaminophen are some common medications that you use a lot. And the goal is when you're studying these meds again to not try and memorize everything about it because it's impossible. But based on what you're hearing from your instructor, from your activities or any homework activities you're doing, from your clinical instructors, from supplemental things you find online that are sort of reinforcing those important need to know concepts, or from practice questions, you want to try and narrow down what it is that you're actually going to be memorizing about these medications. So ibuprofen, it is an NSAID, so that's classification, non-steroid anti-inflammatory drugs. So we got the classification. You'd want to know how the mechanism of action for NSAID. So how does the medicine work? This one specifically, ibuprofen, I would memorize that it's anti-inflammatory. It's part of what differentiates ibuprofen from acetaminophen, is that ibuprofen has the anti-inflammatory properties. Increased risk of bleeding with ibuprofen. Again, what's separating it from acetaminophen. NSAIDs have increased risk of bleeding. Acetaminophen does not have that risk. And so it goes on to say dark stools, vomit that looks like coffee grounds. Along with the bleeding, a lot of times, I don't see it here, but a lot of times you'll hear it associated with GI ulcers and GI ulcer bleeding. So hitting that bleeding again. Can take with food and milk to prevent stomach irritation. And want to watch kidney function with it. Acetaminophen then, it's an analgesic, so it has nothing to do with anti-inflammatory properties. So it's a big difference between it and ibuprofen. Big thing with acetaminophen is we're watching liver function. So recognizing yellowing of the skin or jaundice, pain in the upper right side of the abdomen where the liver's at, that could be indicative of something's going wrong with the liver. You could also note what labs you're going to be looking at for liver function. ALT, AST are the 2 big ones we hit a lot. So when you hear acetaminophen, you think about Tylenol, you should be thinking you're worried about liver function. That's the reason why we have a daily limit. For adults, it's 4,000 milligrams. And so we avoid that because we don't want to cause that sort of liver damage by giving too much. Accidental overdose. So there is she mentioned the accidental overdose. There is a medication that we can give if the patient does overdose. Acetylcysteine is a medication that can be given for acetaminophen overdose. So anytime a med has an antidote for toxicity or overdose, that's something you want to be familiar with. A lot of times you'll see questions related to alcohol use with acetaminophen because you want to recognize that alcohol abuse can negatively affect the liver, and then you're taking a medication that's hard on the liver, so sort of hitting it twice, and we're worried about liver function. So again, the big thing is using your resources to try and narrow down sort of those really important need to know medication topics. You're always going to have resources available to you, or you should. in the clinical setting. So you always have, resources that complete lists of all the side effects, contraindications, all that good stuff. But there are certain things that you just have to have memorized as a nurse. So follow your instructor's lead and as to what those topics for each medication would be. And those are likely the ones that you're going to see show up on exams. Okay, for quiz number 2, I'm going to work on getting these graded this week, so bear with me as I get around to them here, but we'll go over them. You had a question about a patient hospitalized with sickle cell. What client problem is the least priority? And then it gives you some answer options there. Pain, dehydration, inability to cope with the disease, lack of perfusion. So your assignment was to reword and identify strategic words. This student reworded it as, what problem has least priority for a client hospitalized with sickle cell? That's good. Keyword here is least priority. Oops, it's letting us know that it's a negative event query. So least priority tells us it's negative. And then for these, the student has pain is physical, dehydration or physiological. Dehydration is physiological, physical. Inability to cope is psychosocial feelings, and lack of perfusion is physiological, physical. And they picked least important, least priority is the fluffy feelings, inability to cope. The physical things would be prioritized over that. So good job for that one. Here we got another one. Nurses reviewing care plan for hospitalized patient with sickle cell. Which client problem is most important? So same sort of procedure here. What's most important for a client hospitalized with sickle cell? Keywords there is most important. We know it's positive event query there. Eliminated incorrect answers, the student put as the strategy they were using. Since it's using that most important to cue that it's a prioritization, you could use some prioritization strategies with it. And if you come up here, we got pain, bad pain, 10 out of 10. Oxygen saturation of 89. The patient says, I can't cope with the disease. And the BP looks low as well, 80 over 50. So with your prioritization test-taking strategies, you'll do physical over feelings. So I can't cope would be lower priority than these physical findings, pain, oxygen saturation, and blood pressure. Of these, then, we then go to our ABCs. Airway breathing, this respiratory one becomes your priority answer. After that, by the way, C would be circulation. So after oxygen saturation, blood pressure would be next, followed by pain, followed by the feelings. All right, number 3 here. Change of shift. You get assigned some patients. Who are you going to see first? And then you have some patients listed. So reword, let's see what they put here. Which patient should I see first? Priority word there is first. And then it was asking for look at the modifying phrase for each answer option here. So you got a patient, 68-year-old patient event for whom a sterile sputum specimen needs to be sent to the lab. That's the modifying phrase. These sort of end phrases is what's going to help you determine which patient you need to see first. 57-year-old with COPD, pulse ox reading from the previous shift of 90 on room air. 72-year-old with pneumonia who needs to be started on antibiotics. 51-year-old with asthma who reports shortness of breath. After using the bronchodilator inhaler. They picked, let's see, this student picked a 57-year-old with COPD and a pulse ox reading from the previous shift of 90% on room air. So you were headed in the right direction because you picked a patient who had a respiratory thing going on. But it's not unusual for our COPD patients to have a little bit lower O2 saturation. Between 3D and 3F, 3F is actually higher priority because they've gotten an intervention, the bronchodilator, but they still are reporting shortness of breath. So that patient I'm going to follow up on first. Let's keep going here. You enter the room and find a patient pulseless and breathless. What should you do next? Call the physician, begin CPR, listen to lung sounds, or get a BP reading. What are you doing? Indicating strategic words. So you picked next, which is correct, telling us sort of as a prioritization. Then you had to tell us if these answer options were assessment or intervention. So calling the physician is doing, that's an intervention. Beginning CPR is doing, that's an intervention. Auscultating lung sounds is gathering data, it's assessment. Obtaining a blood pressure reading, gathering data, assessment. So very good for that one. Oops. Okay. Next, we're going to look over our week 12 expectations. This week, you're going to be reading chapter 12 of the textbook. You're currently listening to the week 12 reading, and you have one other recording about pyramid strategies or additional test taking strategies. You have 2 assignments. The first one is a activity, or it's not really activity, it's an assignment, like a 2-question assignment related to your group project, and that's going to count as your discussion board grade. So due Wednesday is your group project assignment. You're going to answer the questions related, and it's basically, have you touched base with your partners? Is there anyone you haven't heard from? All that good stuff. So there's no sort of peer response or anything related to this assignment, but it is going to count towards that discussion board grade since you will be communicating with your group partners. So that's going to be due by Wednesday, and then due by Sunday is the week 12 practice questions, where you'll be practicing comparable or like questions. Just a heads up for next week, week 13, you will be assigned quiz number 3 for week 13. That'll be due by the end of the week for that week. Also, you'll be working on your group project. So part of the week 3 activities is just going to be allowing you time, so less time with recordings, things of that sort, so you can use some of that time to work on your group project if you haven't already worked on it or finished it. A reminder, I'm not sure why I picked the 12th as the due date for this, because it's like a Tuesday or something, but I'm leaving it because that's what's been posted on Canvas. So your group project is going to be due by Tuesday the 12th at midnight, and if you have any problems while working on that, just reach out and let me know.